Pleasure to be with you guys today. Thank you for having me. Next slide, please. Uh, two, two slide forward. My name is Louis Gagnon, and I'm the CEO of this company that is about mental health. Mental health is a crisis, and we're here to fill serious gaps that the current system cannot fill. So what's happening? 19% of the population is ill, depression, anxiety, addiction, etc. 51% of the population is at risk. Add those two numbers, 70% of us are suboptimal, going to work not quite ourselves. When you look at a level down, 66% of the 70% is untreated or will not be treated because people are unaware. They don't know the difference between being sad and depressed, or they're stigmatized. 66% untreated. 34% of the 70 is treated. And those who are treated for illness. There's very little about health in there. That is a serious gap. Total Brain got in there and said, we got to do something. We'll invent a digital tool that we call a care assistant for people to do three things. Number one, they monitor their stress using neuroscience. They monitor their mental capacities, emotional and cognitive, and they monitor the risk of illness over time so that they don't get caught too late with a depression that they should have consulted a year before. We're going to detect a problem if there is one. Otherwise, we'll give a clear bill of health and we'll encourage people to be healthier. When we see a problem, we refer it directly to the healthcare system, and therefore we accelerate treatment and diagnostic. In the end, no matter what you do, healthy or not, you have an integrated tool that is also going to help you reduce your stress in the moment, every day, and build your emotional and cognitive capacities over time. The people who pay for this are government agencies, health providers, and corporate HRs. They get real-time brain analytics from a population point of view so that they can manage those population, all anonymous, and they save $17,000 each time an individual gets successfully treated. They also get healthier population, and they have access to health outcome, which helps for reimbursement on the healthcare front. Next slide. We just saw there's a problem. There's a huge gap. We're filling this gap. We're going after three markets. The first one is what we call the affinity market. Large populations. Two clients right now, AARP, and we have a partnership, a global partnership with IBM. And our first client is going to be the Veteran Affairs Administration, 18 million veterans in the US. The business here is we help fill the gap for the VA. And the VA is going to give us between $1 and $1.50 per user every month, 12 to 18 bucks a year, so that we help people manage their mental health. That is what we call a SaaS model, where we have a tiered user base with a cap in terms of the contract value. The second type of contracts is a simple annual license deal. AARP, the largest retiree association in the US, 40 million people, is another guy. Multi-year contract, significant upside on both sides. Second market, clinical. We're going after small clinics that are taking care of addict, substance abuse, or mental health issues. Here, the doctor is going to get data about the patient's going to know what's happening, the doctor is going to be able to understand the impact of his treatment on health, and the patient is going to have our self-care tool to work on his capacities. The doctor is going to pay us between $25 and $25 per month, and he's going to be able to get them all reimbursed by insurance. So it's a money-making thing to make their product better. Great fit. We have 100 of those. This is new for us. We're scaling this business. Third market, corporate, 30 clients, companies like Boeing, Cerner, Nationwide, FTE per month licensing model. So they pay per number of employees, and Boeing has more than 200 employees on our platform. They also pay for the dependents. They can also pay per user. Nationwide does that. In all cases, these are multi-year contracts with about 88% revenue retention. Next slide, please. This year is a critical year for us. COVID has delayed significantly the implementation of our VA business, the VA contract, largest healthcare system in the world. It got derailed by COVID. So we are about to launch. The contract award is imminent. It's been published on the government sites, and it's just going to be awarded really soon. When that happens, 2021 for us ends up at 85% ARR growth. There's an inflection point. It's been a long time coming, but it is a combination of the IBM deal plus another deal that I will tell you about in a minute. Just those two deals, we completely changed the trajectory of our business. And we hope that these are coming real soon. And user growth is going to follow the same way. Next slide, please. First deal is the IBM VA deal. We signed a master agreement with IBM in 2020. There was a huge delay because of COVID. It's been announced by the VA. The contract's going to have 25,000 vets to start, which is 590,000 ARR to us to start. The final contract will have operational pathways and pre-approved budget for significant scaling of the number of vets. We're expecting hundreds of thousands of vets for year 2, and we're going to ramp to that between year 1 and year 2. This single transaction can generate multiple of our current ARR base, and that is capped at 15 million ARR per year for us. It is a game changer. IBM has this contract, many others, and we can get many other IBMs. So you can see how this can scale from a revenue standpoint, given where we are. This is key as a launch for 2021. Next slide, please. We just associated ourselves, announced through a head of agreement with a company called Hamptons Life, Australian-born, owned by a very deep pocket health individual, familiar with the healthcare market. We want to bring together physical health, mental health, and nutrition into one app to sell to consumers directly. The company Hamptons Life has committed to do this with us, where we'll co-create a business. To do this, as per the non-binding agreement we had about a month ago, which is being finalized as we speak, we expect that we're going to have a $6 million fee that's going to be paid upfront to TTB for the perpetual global exclusivity license. We expect an annual fee to TTB, and we expect an option for us to acquire 50% of that business that we will co-create together with Hamptons. There will be minimal annual commercial outcomes required for the exclusivity to be maintained. 2 landmark deals. Next slide. These were affinity deals. Now we have a clinical business that is going to be, that is being launched and scaled. We just hired 2 salespeople in April. We see a much higher velocity, about 1 to 3 month sales cycles. The contracts are smaller than corporates, but sales cycles much shorter. There's 1 or 2 individuals in small clinics to make a decision, but the price per user is going to be 3 or 4x what we've done in average dealing with big corporates. So this market is extremely exciting to us. It is a fantastic product market fit, and it is a game-changing potential in terms of quickly scaling our business. So watch out for this market. 2021 is the year where we're really getting into it, and very excited about it. Next slide. On the corporate side, we are allied with the US top HR partners and mental health partner, One Mind at Work, the HR Policy Association, the National Alliance of Healthcare Purchasers. And every month, we, Total Brain, aggregate the data that we have across all of our 30 customers corporately, and we publish a mental health index. And what you see here is what happened to depression, anxiety, and PTSD together with the COVID curve in 2020-21. Absolutely fascinating data, creating amazing conversations, allowing us to build a solid data-driven brand, super robust, and allowing us to significantly generate more at top of funnel, more leads because of that credibility. So our leads are up 247% since we launched this during the COVID crisis. And we believe that a smart use of this asset is going to accelerate our B2B business significantly in the year to come. Next slide. Question is, why should you invest now? Significant visibility on near-term potential revenue is the answer. This time around, there's no Trump, there's no COVID. If there is COVID, it's not an impediment, it's an opportunity. We are expected to grow by 85% to 6.5 this year, with more growth to be unlocked next year. When the IBM deal scales, it's going to be significant. The VA has already announced its intention. This contract award is expected to be imminent, creating a significant opportunity. Hamptons Life deal is well aligned. This partnership, again, has a very significant upside. We're repositioning our corporate business with the data. We have a very promising clinical business, and our team and product is more ready than ever. I wish I had the time to give you a demo, but if you want one, just reach out to me. I'll be happy to give you one. Thank you so much for your time.
Thank you. Can you actually talk us through the product? Is it an app, or is it some sort of questionnaire and survey? What is the product?
Yeah, can you go to the next slide? I'll show you. Basically, it's an app. We monitor stress, brain capacities, and mental condition. We do it all using the app. On the stress side, we have a wearable where we're able to track your stress in real time, know what stresses you out, what relaxes you, create self-awareness, help you live a better life real time. So that is, how am I feeling right now and what can I do right now? Then there is the capacity. Am I emotionally skilled? Am I cognitively sound? Memory, focus, capacity to make decisions. What's my percentile score? People like me. And what can I do to get better? And then we have the mental condition thing in the back end, where we use standardized tests to evaluate your risk. When we see that you're at risk, we make a referral. And if you move 2 slides, then, so that's the reference. And then no matter who you are, we give you self-care tools. You have your feet on the left, and then in the moment relief activities where you can breathe to manage your stress, have some meditation, have some neuro music specifically designed to relax your brain. And then you can work on different brain capacities to work on your capacities in the long run. That's the product, Tim.
And you've just raised $6.5 million. Is that going towards kind of long-term growth opportunities?
This is going towards accelerating the growth around the affinity market, where we need to dig into IBM, scale the VA, get many more contracts with IBM, and then get another IBM, and put the the gas pedal to the floor on the clinical side, and as much as we will be able to justify that ramp. These are the two big reasons.
And those verticals, corporate and VA and clinical, like corporate would be a big part of it, wouldn't it, in terms of growth, given the responsibility corporates now have to look after their employees, for want of a better word?
You would want that, you would think that, but I find that the dynamic of the buyer is complicated. Mental health is complicated, the HR person is overwhelmed, there is not enough time in the day to communicate the thousands of apps to their employees, and that creates a slew of issues and long sales cycle, which can be addressed, but this is something we've struggled with until now. I think I have a solutions now, but it took us 3 years to figure it out.
And this question here, what's the biggest impediment to increase take up across the platform, across the various channels?
You know, it's just a matter of awareness. If you knew that 70% of your employees were showing up to work suboptimally and your business depends on it, you would buy without questions immediately. We'd give you a dashboard like this where you can track your risk and the cognition of your staff over time. You can drill it by office and by discipline. There is just nothing like it. And like any innovation, it requires a little bit of evangelism to go out there and explain to people. And that has been, and still is, I would say, the biggest impediment. But it's slowly going away as we are building a brand and as we are aligning ourselves with top players in the space.
And just quickly, one last question. What are the privacy issues around this data?
There is no privacy issue because everything is anonymized. So no one can see your data, your employers, or your affinity group. Your clinician will, if you give him permission, and it's all user generated, HIPAA compliant, ISO certified. So we're very solid there.